Are you one of those people who goes to bed with decent blood sugar numbers, only to wake up with readings that make your heart sink? You know what I'm talking about. You check your glucose meter first thing in the morning and see 140, 150, sometimes even 160 milligrams per deciliter staring back at you. And you think to yourself, but I didn't eat anything all night. How did this happen? Well, my friend, you're not alone. And more importantly, you're not powerless against this frustrating phenomenon. What if I told you that there's a simple, natural solution sitting right in your kitchen cabinet that could help you wake up to better blood sugar numbers? What if I told you that by drinking one specific type of tea just 45 minutes before bedtime, you could potentially help your body regulate glucose more effectively throughout the night? Now, I know what you might be thinking. Another miracle cure that sounds too good to be true. But here's the thing. This isn't about miracle cures or overnight transformations. This is about understanding the science behind what happens to your body while you sleep, and using time-tested, research-backed natural remedies to work with your body's natural rhythms, not against them. You see, after working with thousands of people over 50 who struggle with blood sugar management, I've discovered that the key isn't just what you eat during the day. It's also about what you do in those crucial hours before sleep. And one of the most powerful tools in our arsenal is something as simple as the right cup of tea at the right time. But here's where it gets interesting. Not all teas are created equal, and not every person needs the same type of evening tea. Some of you struggle with restless sleep that contributes to morning blood sugar spikes. Others deal with insulin resistance that seems to get worse overnight. Some have digestive issues that cause glucose to spike hours after dinner. And each of these situations calls for a different approach, a different tea, prepared in a specific way. Over the next hour, I'm going to share with you 4 specific teas that have been scientifically studied for their effects on blood glucose, sleep quality, and metabolic health. I'll tell you exactly which tea is right for your specific situation, how to prepare it properly, when to drink it, and most importantly, how to do this safely if you're already taking diabetes medications or have other health conditions. But first, let me share something personal with you. And I've been a practicing endocrinologist for over 20 years. I've seen the frustration in the eyes of countless patients who feel like their bodies are working against them, especially when it comes to those mysterious morning blood sugar spikes. I've also seen the incredible transformation that can happen when people learn to work with their body's natural processes instead of fighting them. 3 years ago, my own mother, Margaret, who was 67 at the time, came to me in tears. Despite following her diet plan perfectly, taking her metformin as prescribed, and even adding evening walks to her routine, she was waking up every morning to blood glucose readings between 140 and 160. Her doctor was talking about adding insulin to her regimen, and she was terrified. That's when I decided to dive deep into the research on circadian rhythms, sleep quality, and glucose metabolism. What I discovered changed not only my mother's life, but the lives of hundreds of my patients, and today, I'm going to share those discoveries with you. Now, before we dive into the specific teas and how to use them, I need to address something crucial. Safety. If you're over 50 and dealing with blood sugar issues, there's a good chance you're taking medications, possibly multiple medications. Some of you might be on insulin, others on medications like glyburide or glipizide. Some might be taking blood thinners like warfarin, or have liver or kidney conditions that affect how your body processes certain compounds. This is not a replacement for your current medical treatment, and you absolutely must discuss any changes to your routine with your healthcare provider, especially if you're taking insulin or sulfonylurea medications, which can cause dangerous low blood sugar reactions when combined with blood sugar lowering herbs. I'll give you specific warnings for each tea we discuss, but please prioritize your safety above everything else. That said, for most people, when used correctly and with proper medical supervision, these teas can be powerful allies in your blood sugar management journey. So let's start by understanding exactly why your blood sugar might be high in the morning, and how the right evening tea can help address the root causes. The phenomenon you're experiencing has a name. It's called the dawn phenomenon, and it affects up to 75% of people with diabetes and even some people without diabetes. Here's what happens. In the early morning hours, typically between 3 and 8 a.m., your body naturally releases stress hormones like cortisol, growth hormone, and adrenaline. These hormones signal your liver to release stored glucose to give you energy to start your day. In a healthy metabolism, this glucose release is perfectly balanced by your body's insulin response. But when you have insulin resistance or diabetes, your body either doesn't make enough insulin to handle this glucose dump, or your cells don't respond properly to the insulin you do make. The result? Those frustratingly high morning blood sugar readings. But here's where it gets more complex, and this is where our evening tea strategy comes into play. The severity of your dawn phenomenon is just determined by your diabetes status. It's heavily influenced by the quality of your sleep, your stress levels, what and when you ate the night before, your activity level, and even the temperature of your bedroom. Poor sleep quality, in particular, wreaks havoc on your glucose metabolism. When you don't get enough deep, restorative sleep, your body produces more cortisol, becomes more insulin resistant, and struggles to regulate glucose effectively. It's a vicious cycle. High blood sugar can make it harder to sleep well, and poor sleep makes blood sugar control more difficult. This is where our evening tea ritual becomes powerful. By choosing the right tea and consuming it at the right time, we can address multiple factors simultaneously. We can promote better sleep quality, reduce nighttime stress hormones, slow down carbohydrate absorption from your evening meal, and even provide compounds that may help improve insulin sensitivity. Now, you might be wondering why tea specifically, and why before bed? Great question. Tea offers several advantages over other beverages or supplements. First, the act of preparing and slowly sipping a warm beverage can be incredibly relaxing and help signal to your body that it's time to wind down. This psychological and physiological cue can be just as important as the active compounds in the tea itself. Second, many of the beneficial compounds in tea are better absorbed when consumed as part of a warm liquid, and they're often gentler on the stomach than concentrated supplements. Third, unlike coffee or other caffeinated beverages that would keep you awake, the teas we'll discuss are either caffeine-free or very low in caffeine, making them perfect for evening consumption. The key is choosing the right tea for your specific situation and preparing it correctly. Over the years, I've identified for standout teas that, when used strategically, can help address different aspects of overnight blood sugar management. Let me tell you about each one, and then I'll help you determine which one might be best for your particular situation. Our first tea is one that many of you probably already have in your spice cabinet: cinnamon. Now, I'm not talking about just any cinnamon. There are actually several types of cinnamon, and for our purposes, Ceylon cinnamon, also known as true cinnamon, is superior to the more common cassia cinnamon you find in most grocery stores. Ceylon cinnamon contains lower levels of coumarin, a compound that can be harmful to your liver in large quantities, while still providing the beneficial polyphenols that give cinnamon its blood sugar lowering properties. These polyphenols work by mimicking insulin's action on cells, helping glucose enter cells more efficiently. Some studies have shown that cinnamon can reduce fasting blood glucose by 10 to 25% in people with type 2 diabetes. But here's what makes cinnamon tea particularly effective. As an evening beverage, it works slowly and gently. Unlike rapid-acting diabetes medications, cinnamon's effects build up over hours, making it perfect for addressing that early morning glucose release. When you drink cinnamon tea 45 to 60 minutes before bed, the active compounds are still circulating in your system during those critical dawn hours when your liver is releasing stored glucose. The research on cinnamon and blood sugar is quite compelling. A study published in the Journal of Medicinal Food found that people with type 2 diabetes who consume cinnamon extract experience significant reductions in fasting glucose levels over a 12-week period. Another study in the Annals of Family Medicine showed that cinnamon consumption was associated with improved glucose control and lipid profiles. Now, preparing cinnamon tea properly is crucial for both effectiveness and safety. You'll want to use Ceylon cinnamon sticks, not powder, and definitely not those artificially flavored cinnamon tea bags you find in most stores. Here's exactly how to prepare it. Take 1 Ceylon cinnamon stick, about 3 inches long, and break it into 2 to 3 pieces. Place these pieces in a cup and pour 8 ounces of hot water over them. Not boiling water, but water that's about 185 to 200 degrees Fahrenheit. Cover the cup and let it steep for 8 to 10 minutes. This longer steeping time is important because it takes time to extract the beneficial compounds from the cinnamon bark. After steeping, remove the cinnamon pieces. You can save them and reuse them once more if you'd like. Do not add any sweeteners, especially not sugar or honey. If you absolutely must have some sweetness, a tiny amount of stevia is acceptable, but really, try to train your palate to enjoy the warm, slightly sweet natural flavor of the cinnamon. For an extra boost, you can add a whole clove or 2 during steeping, or squeeze a small amount of fresh lemon juice into the finished tea. Both of these additions have their own blood sugar benefits. Cloves contain compounds that may help improve insulin sensitivity, and lemon can help slow the absorption of any carbohydrates remaining in your system from dinner. The ideal amount for most people is 1 cup. Consume 45 to 60 minutes before your intended bedtime. This timing is important because you want the compounds to be actively working in your system during the night. But you also don't want to be making trips to the bathroom all night long. Now, let's talk about safety considerations for cinnamon tea, because this is absolutely crucial. If you have any liver conditions, including fatty liver disease or elevated liver enzymes, you should avoid cinnamon supplements entirely and use cinnamon tea only under medical supervision. Even Ceylon cinnamon contains some coumarin, and if your liver isn't functioning optimally, even small amounts could be problematic if you're taking diabetes medications, particularly insulin or sulfonylurea drugs like glyburide, glimepiride, or glipizide. You need to monitor your blood sugar extra carefully when starting cinnamon tea. These medications can cause dangerously low blood sugar, and adding cinnamon's glucose-lowering effects could push you into hypoglycemia. Start with half a cup every other night. Monitor your morning readings closely, and be prepared to adjust your medication doses with your doctor's guidance. Also, if you're taking any blood-thinning medications, cinnamon can potentially enhance their effects, so please discuss this with your healthcare provider before starting. Cinnamon tea is particularly beneficial for people whose primary issue is insulin resistance. If your fasting blood sugars are consistently elevated, if you've been told you have metabolic syndrome, or if you tend to have high blood glucose readings even when you haven't eaten for many hours, cinnamon tea might be your best starting point. Our second evening tea option is one that many of you might be surprised to learn has blood sugar benefits: chamomile. Most people think of chamomile purely as a sleep aid, and while it's certainly excellent for that purpose, recent research has revealed some fascinating connections between chamomile consumption and glucose metabolism. Chamomile contains a flavonoid called apigenin, which is responsible for many of its calming effects. But apigenin does more than just help you relax. It appears to have significant effects on glucose metabolism and insulin sensitivity. A study published in the Journal of Endocrinological Investigation found that people with type 2 diabetes who consumed chamomile tea 3 times daily after meals experienced significant reductions in HbA1c levels, a measure of long-term blood sugar control. But here's what makes chamomile particularly interesting for our evening routine: its effects on sleep quality. Poor sleep is one of the most underestimated factors in blood sugar control. When you don't get adequate deep sleep, your body produces more stress hormones, becomes more insulin resistant, and struggles to regulate glucose effectively. Chamomile doesn't just help you fall asleep faster, it helps you achieve more restorative deep sleep phases. The connection between sleep quality and blood sugar control is profound. During deep sleep, your body repairs tissues, consolidates memories, and most importantly for our purposes, resets your metabolic hormones. Growth hormone is released, which helps with tissue repair, but can also cause temporary insulin resistance. Cortisol levels should naturally drop to their lowest point. If your sleep is fragmented or insufficient, these hormonal rhythms get disrupted, leading to higher morning glucose levels. Research published in the Sleep Medicine Reviews journal showed that people who consistently get less than 6 hours of sleep per night have a 30% higher risk of developing diabetes. Even more relevant to our discussion, studies have shown that even one night of poor sleep can reduce insulin sensitivity by up to 25% the next day. This is where chamomile becomes particularly powerful for people whose blood sugar issues are connected to sleep problems or chronic stress. If you find yourself lying awake at night worrying about your health, your family, your finances, or just unable to turn off your racing mind, chamomile tea can be a gentle, natural way to help transition your body into a more relaxed state conducive to better sleep and better glucose control. The way chamomile works is quite elegant. Apigenin binds to specific receptors in your brain called benzodiazepine receptors. These are the same receptors that anti-anxiety medications target. But chamomile's effects are much gentler and don't come with the dependency risks or morning grogginess associated with pharmaceutical sleep aids. But chamomile's benefits for blood sugar go beyond just improving sleep. The tea contains other compounds, including flavonoids and terpenoids, that appear to have direct effects on glucose metabolism. Some research suggests that these compounds may help improve insulin sensitivity and reduce inflammation, both crucial factors in blood sugar control. Preparing chamomile tea correctly is simpler than cinnamon tea, but there are still some important details to get right. You'll want to use dried chamomile flowers, not pre-made tea bags if possible, though high-quality organic chamomile tea bags are acceptable if that's what you have access to. The flowers contain higher concentrations of the active compounds than the stems and leaves often found in cheaper tea blends. Here's how to prepare it properly. Use about 1 tablespoon of dried chamomile flowers or 2 high-quality tea bags per cup of water. Heat your water to about 200 degrees Fahrenheit, just short of boiling. Pour the water over the chamomile and immediately cover the cup. This is crucial because many of chamomile's beneficial compounds are volatile oils that will escape if the tea isn't covered during steeping. Steep for 5 to 7 minutes for optimal extraction of the beneficial compounds. Longer steeping can make the tea bitter without providing additional benefits. After steeping, strain out the flowers or remove the tea bags. Again, avoid adding sweeteners, but if you must, a tiny amount of stevia is preferable to sugar or honey. For enhanced blood sugar benefits, you can add a small pinch of Ceylon cinnamon powder to your chamomile tea, combining the benefits of both herbs. The flavors actually complement each other quite nicely, creating a warm, soothing beverage that's perfect for evening relaxation. The ideal timing for chamomile tea is about 30 to 45 minutes before bed. This gives the apigenin time to start working on your nervous system while still allowing you to empty your bladder before settling in for the night. Many people find that making chamomile tea part of a consistent bedtime routine, perhaps while doing some gentle stretching, reading, or practicing breathing exercises, enhances its effectiveness. Now, let's discuss safety considerations for chamomile. Because while it's generally very safe for most people, there are some important exceptions. The most significant concern is for people taking blood-thinning medications like warfarin, apixaban, or rivaroxaban. Chamomile can potentially enhance the effects of these medications, increasing your risk of bleeding. If you're on any blood thinners, you absolutely must consult with your healthcare provider before adding chamomile tea to your routine. Chamomile can also cause allergic reactions in people who are sensitive to plants in the Asteraceae family, which includes ragweed, chrysanthemums, marigolds, and daisies. If you have seasonal allergies to these plants, you might also react to chamomile. Start with a very small amount and watch for any signs of allergic reaction, including skin rash, difficulty breathing, or swelling. Some people also experience mild drowsiness the morning after drinking chamomile tea, though this is much less common than with pharmaceutical sleep aids. If you do experience morning grogginess, try reducing the amount of chamomile you're using or drinking the tea earlier in the evening. Chamomile tea is particularly beneficial for people whose blood sugar issues are complicated by poor sleep, anxiety, or chronic stress. If you find yourself lying awake at night, if you wake up frequently during the night, if you feel tired even after what should have been a full night's sleep, or if you know that stress and worrying are significant factors in your life, chamomile tea might be your best choice. Our third tea option is one that might surprise you with its versatility: ginger tea. Most people think of ginger primarily as a digestive aid or something to help with nausea, and while it's certainly excellent for both of those purposes, ginger has some remarkable effects on blood sugar metabolism that make it particularly useful as an evening beverage. Ginger contains several bioactive compounds, the most notable being gingerols and chagols. These compounds have powerful anti-inflammatory properties, but they also appear to influence glucose metabolism in several important ways. Research has shown that ginger can help slow the absorption of carbohydrates in the small intestine, reduce the rate at which the stomach empties, and even improve insulin sensitivity. A study published in the European Journal of Pharmacology found that ginger extract significantly reduced fasting blood glucose levels and improved glucose tolerance in diabetic rats. More importantly for our purposes, human studies have shown similar benefits. A randomized controlled trial published in Complementary Therapies in Medicine found that people with type 2 diabetes who consume ginger powder daily experience significant reductions in fasting blood glucose, HbA1c levels, and insulin resistance markers. But here's what makes ginger particularly valuable as an evening tea: its effects on gastric emptying and post-meal glucose spikes. Many people, especially as we age, experience what's called delayed gastric emptying or gastroparesis. This means food sits in the stomach longer than it should before moving into the small intestine for absorption. When this happens, you can experience glucose spikes hours after eating, sometimes even extending into the next morning. This is particularly problematic if you eat dinner late or have a larger evening meal. Even if you think you've given yourself enough time between dinner and bedtime, delayed gastric emptying can mean that carbohydrates from your evening meal are still being absorbed while you sleep, contributing to those frustrating morning blood sugar spikes. Ginger helps address this issue in a fascinating way. While it slows down the absorption of carbohydrates once they reach the small intestine, it actually helps normalize gastric emptying, ensuring that food moves through your digestive system at an appropriate pace. This means more predictable glucose absorption patterns and fewer delayed glucose spikes. The anti-inflammatory properties of ginger are also particularly relevant for blood sugar control. Chronic low-grade inflammation is a major contributor to insulin resistance and diabetes complications. The gingerols in ginger have been shown to reduce inflammatory markers and may help improve insulin sensitivity over time. Preparing ginger tea is straightforward, but using fresh ginger rather than dried powder will give you the most potent effects. Here's the best way to prepare it. Take a piece of fresh ginger root about 1 to 2 inches long, depending on how strong you like your tea. Peel the ginger using a spoon or vegetable peeler, then slice it into thin rounds. You want thin slices because this increases the surface area and allows for better extraction of the active compounds. Place the ginger slices in a cup and pour hot water over them. Again, about 200 degrees Fahrenheit, not boiling. Cover the cup and let it steep for 10 minutes. This longer steeping time is necessary to extract the beneficial gingerols from the fresh ginger. After steeping, strain out the ginger pieces. Though some people prefer to leave them in and eat them as they drink the tea, For enhanced blood sugar benefits, you can add a cinnamon stick during steeping, or squeeze some fresh lemon juice into the finished tea. Both of these additions complement ginger's effects nicely. The lemon provides vitamin C and compounds that can help slow carbohydrate absorption, while cinnamon adds its own glucose-lowering properties. The ideal timing for ginger tea is about 45 to 60 minutes before bed, similar to cinnamon tea. This allows time for the compounds to be absorbed and start working while still giving you time to empty your bladder before sleep. Some people find ginger tea slightly energizing rather than sedating. So, if you're sensitive to this effect, you might want to drink it a bit earlier in the evening. Now, let's talk about safety considerations for ginger tea. Because while ginger is generally very safe, there are some important interactions and contraindications to be aware of. The most significant concern is for people taking blood-thinning medications. Ginger can enhance the effects of anticoagulant and antiplatelet drugs, potentially increasing your risk of bleeding. If you're taking warfarin, heparin, aspirin, or other blood thinners, you must consult with your healthcare provider before adding ginger tea to your routine. Ginger can also potentially interact with diabetes medications, though usually in a beneficial way. However, if you're taking insulin or sulfonylurea medications, you'll need to monitor your blood sugar carefully when starting ginger tea, as the combination could potentially cause hypoglycemia. Some people experience mild stomach irritation from ginger, especially if they have a history of acid reflux or gastroesophageal reflux disease. If you have these conditions, start with a very mild ginger tea and see how you tolerate it. Interestingly, while ginger can sometimes initially cause mild heartburn in sensitive individuals, it often actually helps reduce acid reflux symptoms over time by improving gastric motility. Ginger may also interact with certain heart medications and can potentially affect blood pressure. If you're taking medications for heart conditions or high blood pressure, discuss ginger consumption with your healthcare provider. Pregnant women should avoid medicinal amounts of ginger, though small amounts used in cooking are generally considered safe. If you're planning to become pregnant or are currently pregnant, avoid ginger tea. Ginger tea is particularly beneficial for people who experience digestive issues that affect their blood sugar control. If you often feel uncomfortably full hours after dinner, if you experience bloating or digestive discomfort in the evenings, if you notice that your blood sugar seems to spike unpredictably hours after meals, or if you have been diagnosed with gastroparesis or delayed gastric emptying, ginger tea might be your best choice. Our fourth and final tea option is one that many people haven't heard of, but that has some of the most impressive research behind it for blood sugar control: fenugreek tea. Fenugreek seeds have been used in traditional medicine for thousands of years, but only recently has modern science begun to understand exactly how powerful they can be for glucose metabolism. Fenugreek seeds contain several unique compounds that make them particularly effective for blood sugar control. The most notable is a compound called 4-hydroxyisoleucine, an amino acid that has been shown to stimulate insulin production only in the presence of elevated blood glucose. This means it helps lower blood sugar when it's high, but doesn't cause dangerous hypoglycemia when blood sugar is normal. Fenugreek seeds also contain high levels of soluble fiber, particularly galactomannan. These fibers form a gel-like substance in the digestive tract that slows the absorption of carbohydrates and helps prevent rapid glucose spikes. This fiber also provides food for beneficial gut bacteria, which emerging research suggests play an important role in glucose metabolism and insulin sensitivity. The research on fenugreek and blood sugar control is quite impressive. A study published in the European Journal of Clinical Nutrition found that people with type 1 diabetes who added fenugreek seed powder to their diet experienced significant reductions in fasting blood glucose and improvements in glucose tolerance. Even more relevant to our discussion, a study in the International Journal of Medical Sciences found that fenugreek extract consumed before bedtime helped reduce fasting glucose levels the following morning. But perhaps the most compelling research comes from a study published in Nutrition Research, which found that people with prediabetes who consumed fenugreek seed extract experienced not only improvements in fasting glucose, but also significant improvements in insulin sensitivity and even some weight loss over a 12-week period. What makes fenugreek particularly interesting as an evening tea is its slow, sustained action. Unlike rapid-acting diabetes medications that work within minutes or hours, fenugreek's effects build up over time and can last for many hours. When consumed as a tea 45 to 60 minutes before bed, fenugreek can provide blood sugar benefits throughout the night and into the next morning. Fenugreek also has some interesting effects on appetite and satiety. Many people find that consuming fenugreek helps reduce late-night cravings and the desire for bedtime snacks, which can be a significant contributor to morning blood sugar spikes. This appetite-suppressing effect, combined with its direct glucose-lowering properties, makes fenugreek tea a powerful tool for overnight blood sugar management. Preparing fenugreek tea requires a bit more effort than our other options, but the results are worth it. Fenugreek seeds are quite hard and need some preparation to release their beneficial compounds. You'll want to start with whole fenugreek seeds, which you can usually find at health food stores, Indian grocery stores, or online. Here's the best way to prepare fenugreek tea. Take about 1 teaspoon of fenugreek seeds and lightly crush them using a mortar and pestle, or place them in a small plastic bag and gently crush them with a rolling pin. You don't want to powder them completely, just crack them open to allow the water to extract the beneficial compounds. Place the crushed seeds in a cup and add room temperature water to cover them. Let them soak for 10 to 15 minutes. This soaking step is important because it allows the seeds to begin releasing their soluble fibers and other compounds. After soaking, pour hot water, about 200 degrees Fahrenheit, over the seeds and cover the cup. Steep for 10 minutes, then strain out the seeds. The resulting tea will have a slightly bitter, somewhat nutty flavor. This is normal and indicates that you've successfully extracted the beneficial compounds. Many people find the taste grows on them over time, but if you find it too bitter initially, you can add a small amount of stevia or a squeeze of lemon juice. Some people prefer to drink the tea without straining out all the seeds, as the fiber from the partially softened seeds can provide additional benefits. If you choose to do this, chew the seeds thoroughly to aid digestion. The ideal timing for fenugreek tea is 45 to 60 minutes before bed, similar to our other options. However, because fenugreek can have mild appetite-suppressing effects, some people prefer to drink it earlier in the evening, perhaps right after dinner, to help prevent late-night snacking. Now, let's discuss safety considerations for fenugreek tea. Because while it's generally safe for most people, there are some important precautions to be aware of. The most significant concern is the potential for hypoglycemia, especially if you're taking diabetes medications. Fenugreek can significantly lower blood glucose, and when combined with insulin or sulfonylurea medications, this could result in dangerously low blood sugar. If you're taking any diabetes medications, you absolutely must start with a very small amount of fenugreek tea, perhaps just a quarter teaspoon of seeds to start, and monitor your blood glucose carefully. Be prepared to work with your healthcare provider to adjust your medication doses as needed. Fenugreek should be avoided during pregnancy, as it can stimulate uterine contractions. If you're pregnant, planning to become pregnant, or breastfeeding, avoid fenugreek tea. Some people experience mild gastrointestinal side effects when starting fenugreek, including bloating, gas, or changes in bowel movements. These effects are usually temporary and resolve as your digestive system adjusts to the increased fiber intake. Starting with a smaller amount and gradually increasing can help minimize these effects. Fenugreek can also cause your sweat and urine to have a distinctive maple syrup-like odor. This is completely harmless and is due to a compound called sodolone, but it can be surprising if you're not expecting it. There's also a small risk of allergic reactions to fenugreek, particularly if you're allergic to other legumes like peanuts, chickpeas, or green peas. As fenugreek belongs to the same plant family, fenugreek tea is particularly beneficial for people who need extra support for blood sugar control, especially those with consistently high fasting glucose levels, those who have been told they have prediabetes or metabolic syndrome, or those who struggle with late-night cravings that contribute to morning blood sugar spikes. Now that we've covered all 4 tea options in detail, let's talk about how to choose which one is right for your specific situation. This decision should be based on your primary challenges with blood sugar control, your current health status, any medications you're taking, and your personal preferences. If your main issue is insulin resistance and consistently elevated fasting blood glucose, let's say your morning readings are typically between 130 and 160 milligrams EDL despite following your diet and taking your medications, then cinnamon tea or fenugreek tea would be your best starting points. Both of these have the strongest research support specifically for improving insulin sensitivity and reducing fasting glucose levels. Between these two, cinnamon tea is gentler and easier to prepare, making it a good choice if you're just starting to experiment with herbal approaches to blood sugar management. Fenugreek tea is more potent, but requires more preparation and has a stronger potential for drug interactions. So, it's better suited for people who need more aggressive blood sugar support and can work closely with their healthcare provider. If your primary challenge is poor sleep quality that you suspect is contributing to your blood sugar issues, maybe you have trouble falling asleep, you wake up frequently during the night, or you feel anxious or stressed in the evenings, then chamomile tea is your best choice. While it may not have as direct an effect on glucose metabolism as cinnamon or fenugreek, its benefits for sleep quality can have profound indirect effects on blood sugar control. Remember, poor sleep is one of the most underestimated factors in blood sugar management. If you can improve your sleep quality, you'll likely see improvements in your morning glucose readings even without other interventions. And chamomile's gentle anti-anxiety effects can help break the cycle of stress and worrying that often accompanies blood sugar management challenges. If you're dealing with digestive issues that seem to affect your blood sugar control, perhaps you notice unpredictable glucose spikes hours after meals, you often feel uncomfortably full long after eating, or you've been told you have gastroparesis or delayed gastric emptying, then ginger tea is likely your best option. Ginger's unique combination of effects on gastric motility and carbohydrate absorption make it particularly valuable for people with digestive-related blood sugar challenges. It's also worth considering combination approaches, but only after you've tested each tea individually. For example, some people find that alternating between cinnamon tea and chamomile tea, perhaps using cinnamon tea on nights when blood sugar control is the primary concern and chamomile tea on nights when sleep quality is more important, works well for them. Others find that adding a small amount of cinnamon to their chamomile tea or ginger tea provides enhanced blood sugar benefits without significantly altering the taste. However, I strongly recommend testing each tea individually for at least a week before trying combinations, so you can clearly understand how each one affects you. Now, let's talk about the practical aspects of implementing your evening tea routine. Timing is crucial for optimal results. You want to drink your chosen tea 45 to 60 minutes before your intended bedtime. This timing serves several purposes. It allows time for the beneficial compounds to be absorbed and begin working. It gives you time to empty your bladder before settling in for the night, and it helps create a psychological signal that bedtime is approaching. The amount of tea is also important. For most people, 8 to 10 ounces is ideal. Enough to provide therapeutic benefits, but not so much that you'll be awakened by the need to urinate during the night. If you find that even this amount is causing nighttime bathroom trips, you can reduce to 6 ounces and see if you still get benefits. Temperature matters too, though perhaps not in the way you might expect. While you want your tea hot when you prepare it to properly extract the beneficial compounds, you don't need to drink it while it's still steaming hot. In fact, Drinking beverages that are too hot can actually interfere with sleep by raising your core body temperature. Let your tea cool to a comfortable drinking temperature before consuming it. The preparation ritual itself can be just as important as the tea itself. Use this time to begin winding down from your day. Turn off electronic devices, dim the lights, perhaps do some gentle stretching or breathing exercises while your tea steeps. This ritual helps signal to your body that it's time to transition into evening mode, which can enhance both the tea's effects and your overall sleep quality. Consistency is key to seeing results. Your body's circadian rhythms and metabolic processes respond best to regular, predictable patterns. Try to drink your tea at approximately the same time each night, and maintain this routine even on weekends or during travel when possible. Now, let's discuss what not to add to your tea, because this is where many people unknowingly sabotage their results. Do not add any caloric sweeteners to your evening tea. This includes sugar, honey, agave syrup, or artificial sweeteners that can trigger insulin responses. The goal is to help stabilize your blood sugar overnight, not to cause additional glucose spikes. If you absolutely must have some sweetness in your tea, a few drops of liquid stevia are acceptable, but really try to train your palate to appreciate the natural flavors of these teas. Most people find that after a week or two, they actually prefer the unsweetened versions. Also, avoid adding milk or cream to your evening tea. While these additions won't necessarily harm the beneficial effects of the herbs, they do add calories and can stimulate some insulin release, which is counterproductive to our goals. If you want to enhance the flavor of your tea, stick to additions like fresh lemon juice, a small piece of fresh ginger, or a cinnamon stick. Let's talk about creating a comprehensive 7-night testing plan that will help you determine whether your chosen tea is actually making a difference in your blood sugar control. This systematic approach is crucial because blood glucose can be influenced by so many factors that it's easy to attribute improvements or lack of improvement to the wrong causes. Before you start drinking any evening tea, you need to establish your baseline. For 3 consecutive nights, follow your normal routine without adding any evening tea. During these 3 nights, record your fasting blood glucose each morning immediately upon waking, before eating or drinking anything except water. Also record what time you went to bed, approximately how many hours you slept, what and when you ate for dinner, whether you took any evening walks or exercise, and any other factors that might influence your blood sugar. This baseline data is crucial because it gives you a clear picture of where you're starting from. Many people think they know what their typical fasting glucose readings are, but when they actually start recording them systematically, they often discover more variability than they expected. After establishing your baseline, choose one tea based on the guidelines we discussed earlier, and commit to drinking it every night for 7 consecutive nights. Consistency is absolutely crucial during this testing period. Drink the same amount of tea, prepared the same way, at the same time each night. Continue recording the same data points you tracked during your baseline period. On the 3rd night of your tea trial, assess how things are going. Are you noticing any changes in your fasting glucose readings? How is your sleep quality? Are you experiencing any side effects or digestive issues? This midpoint check allows you to make small adjustments if needed, perhaps reducing the amount of tea if you're experiencing stomach upset, or adjusting the timing if you're having bathroom interruptions during the night. It's important to watch for signs of hypoglycemia during this testing period, especially if you're taking diabetes medications. Symptoms of low blood sugar include shakiness, sweating, confusion, rapid heartbeat, dizziness, or feeling unusually hungry. If you experience any of these symptoms, test your blood glucose immediately, and if it's below 70 milligrams EDL, treat it with 15 to 20 grams of fast-acting carbohydrates and contact your healthcare provider. After completing your 7-night trial, analyze your results. Compare your average fasting glucose during the tea week to your baseline average. Look for patterns. Did your readings improve gradually over the week, or were there immediate changes? Also consider the overall range of your readings. Even if your average didn't change dramatically, you might notice that your readings became more consistent, with fewer extreme highs or lows. Don't expect dramatic overnight transformations. A reduction of 10 to 20 milligrams EDL in average fasting glucose over a week is actually quite significant and clinically meaningful. Remember, we're looking for sustainable, gentle improvements, not rapid dramatic changes that might not be maintainable if you don't see the results you were hoping for with your first choice of tea. Don't give up on the approach entirely. Try a different tea that might be better suited to your specific situation. Some people find that ginger tea works better for them than cinnamon tea, or that chamomile provides benefits they didn't get from fenugreek. The key is systematic testing, not random experimentation. Now, let's discuss how to enhance the effectiveness of your evening tea routine with complementary lifestyle practices that can amplify its benefits. These additional strategies work synergistically with your tea to create an even more powerful approach to overnight blood sugar management. First, let's talk about dinner timing and composition. What and when you eat for dinner has a profound impact on your overnight blood sugar patterns, and you can optimize these factors to work with your evening tea rather than against it. Ideally, you should finish dinner at least 3 to 4 hours before bedtime. This gives your digestive system time to process the meal and helps prevent late-night glucose spikes. If you typically eat dinner at 7 p.m. and go to bed at 10 p.m., you're not allowing enough time for proper digestion. Late dinners, especially those high in carbohydrates, can cause glucose spikes that extend well into the night and contribute to elevated morning readings. If your schedule makes it impossible to eat dinner earlier, consider having a lighter evening meal and making lunch your largest meal of the day. The composition of your dinner is just as important as the timing. Focus on lean proteins, non-starchy vegetables, and modest portions of complex carbohydrates. Avoid simple carbohydrates, sugary desserts, and large portions of starchy foods in the evening. These foods can cause prolonged glucose elevation that will work against your evening tea's benefits. Consider incorporating foods that have their own blood sugar stabilizing properties into your dinner routine. Leafy greens like spinach and kale, cruciferous vegetables like broccoli and cauliflower, and foods rich in magnesium like almonds and avocados can all contribute to better overnight glucose control. After dinner, a gentle walk of 10 to 20 minutes can work wonders for your blood sugar management. This doesn't need to be intense exercise. Just a leisurely stroll around your neighborhood or even walking in place while watching television can help. This post-dinner movement helps your muscles absorb glucose from your bloodstream and can prevent the sharp post-meal spikes that sometimes extend into the night. The timing of this walk is important. You want to walk within 30 minutes of finishing your meal for maximum blood sugar benefits. Some people worry about exercising too close to bedtime, but gentle walking actually tends to be relaxing rather than stimulating and can help prepare your body for better sleep. Your sleep environment plays a crucial role in both the quality of your sleep and your overnight glucose control. Your bedroom should be cool, ideally between 65 and 68 degrees Fahrenheit. Higher temperatures can interfere with deep sleep and may contribute to increased stress hormone production during the night. Complete darkness is also important. Even small amounts of light from electronic devices, street lights, or digital clocks can interfere with your body's natural circadian rhythms and melatonin production. Consider blackout curtains or an eye mask if necessary. Electronic devices deserve special attention in your evening routine. The blue light emitted by phones, tablets, televisions, and computers can suppress melatonin production and interfere with your natural sleep-wake cycle. Try to avoid all screens for at least 1 hour before bedtime, and definitely avoid checking your phone or watching television while drinking your evening tea. Instead, use your tea time for relaxing activities that support better sleep and stress reduction. Reading a physical book, doing gentle stretching, practicing meditation or deep breathing exercises, or simply sitting quietly and reflecting on your day can all enhance the benefits of your evening tea routine. Speaking of breathing exercises, there's one particular technique that pairs beautifully with evening tea consumption, the 4-7-8 breathing pattern. This simple technique can help activate your parasympathetic nervous system, reduce stress hormones, and prepare your body for more restful sleep. Here's how to do it. Sit comfortably while sipping your tea. Place your tongue against the roof of your mouth behind your front teeth and exhale completely. Close your mouth and inhale through your nose for a count of 4. Hold your breath for a count of 7. Exhale through your mouth for a count of 8, making a gentle whooshing sound. Repeat this cycle 3 to 4 times. This breathing pattern helps shift your nervous system from the sympathetic fight or flight mode into the parasympathetic rest and digest mode, which is optimal for both sleep and blood sugar control. The longer exhale helps activate the vagus nerve, which plays a crucial role in glucose metabolism and insulin sensitivity. Magnesium is another factor worth considering in your evening routine. This mineral plays crucial roles in glucose metabolism, insulin sensitivity, and sleep quality. Many people, especially those over 50, are deficient in magnesium without realizing it. While I don't generally recommend taking supplements without medical supervision, you can easily increase your magnesium intake through food choices. Consider having a small handful of almonds or pumpkin seeds with your evening tea, or include magnesium-rich foods like leafy greens, avocados, or dark chocolate in your dinner routine. Some people find that taking a warm bath with Epsom salts magnesium sulfate before their evening tea routine helps with both relaxation and magnesium absorption through the skin. Alcohol deserves special mention in the context of evening blood sugar management. While a glass of wine with dinner might seem relaxing, alcohol can significantly interfere with your sleep quality and glucose control. Alcohol initially causes blood sugar to drop, but then often leads to rebound hyperglycemia several hours later. It also interferes with deep sleep phases and can contribute to early morning awakenings. If you do choose to have alcohol with dinner, keep it to one drink and have it with food rather than on an empty stomach. Avoid alcohol entirely within 3 hours of bedtime, and never combine alcohol with your evening tea routine. Stress management is perhaps one of the most underestimated factors in blood sugar control, especially for people over 50 who often face multiple life stressors simultaneously. Chronic stress leads to elevated cortisol levels, which directly contribute to insulin resistance and elevated blood glucose. Evening is often when the stresses of the day catch up with us, making stress management techniques particularly valuable as part of your tea routine. Consider keeping a small journal where you write down 3 things you're grateful for each day while you drink your evening tea. This simple practice has been shown to reduce stress hormones and improve sleep quality. Alternatively, you might use your tea time to practice progressive muscle relaxation, where you systematically tense and then relax each muscle group in your body. Prayer, meditation, or other spiritual practices can also be powerful additions to your evening routine if they're part of your belief system. The key is finding practices that help you release the tensions and worries of the day rather than carrying them into your sleep. Let's discuss some real-world examples of how these principles work in practice. I want to share 3 case studies from my practice that illustrate how different people have successfully used evening tea routines to improve their blood sugar control. Margaret, whom I mentioned earlier, is 67 years old and was struggling with fasting glucose readings consistently between 140 and 160 milligrams a DL despite taking metformin and following a careful diet. Her main issue seemed to be insulin resistance, as her post-meal readings weren't terrible, but her fasting numbers were stubbornly high. We started Margaret on Ceylon cinnamon tea. 1 cup consumed 45 minutes before her 10 p.m. bedtime. She also moved her dinner from 7:30 p.m. to 6 p.m. and added a 15-minute walk after dinner. Within the first week, Her average fasting glucose dropped to 128 milligrams EDL. After a month of consistent use, she was averaging 115 milligrams EDL in the mornings, a reduction of nearly 30 points from her starting average. The key factors in Margaret's success were consistency. She never missed her evening tea routine, and the combination approach. The earlier dinner timing and post-dinner walk worked synergistically with the cinnamon tea to provide better results than any single intervention likely would have achieved alone. Robert, age 73, had a different challenge. His blood sugar control was reasonably good during the day, but he struggled with terrible sleep quality. He would often lie awake for hours, and when he did sleep, he woke up frequently throughout the night. His morning glucose readings were erratic, sometimes normal, but often elevated, and he felt exhausted most days. We started Robert on chamomile tea, combined with a strict evening routine that included turning off all electronic devices 1 hour before bed and doing gentle stretching while his tea steeped. The changes weren't immediate. It took about 10 days before Robert started noticing improved sleep quality. But once his sleep improved, his morning glucose readings became much more consistent, averaging about 15 milligrams IDL than his pre-treatment baseline. Robert's case illustrates an important point. Sometimes the path to better blood sugar control is indirect. By focusing on sleep quality rather than glucose directly, he achieved better overall metabolic health. Linda, age 59, had been dealing with gastroparesis, a condition where the stomach empties more slowly than normal. This caused unpredictable blood sugar spikes, sometimes hours after eating, and made it very difficult for her to predict when her glucose would be elevated. Her endocrinologist had prescribed medications to help with gastric motility, but she was still struggling with erratic readings. We added ginger tea to Linda's evening routine, timed about 1 hour after her dinner. The ginger helped normalize her gastric emptying, making her glucose patterns much more predictable. Her morning readings didn't change dramatically, but the variability in her numbers decreased significantly. Instead of ranging from 105 to 180 milligrams EDL from day to day, her morning readings settled into a much tighter range of 115 to 135 milligrams EDL. For Linda, the benefit wasn't so much lower numbers as more predictable numbers, which made it much easier for her to manage her overall diabetes care. These cases illustrate several important principles. First, different people need different approaches based on their specific challenges. Second, the benefits of evening tea routines aren't always immediately obvious. Sometimes you need to look at patterns over time rather than day-to-day changes. Third, combining the tea routine with other supportive practices usually produces better results than relying on the tea alone. Now let's address some frequently asked questions that people often have about using evening teas for blood sugar management, because understanding these details can make the difference between success and disappointment with this approach. One of the most common questions is whether green tea can be used as an evening beverage. While green tea does have some blood sugar benefits due to its polyphenol content, particularly a compound called EGCG, it contains significant amounts of caffeine that can interfere with sleep quality. Even decaffeinated green tea often contains enough residual caffeine to be problematic for sensitive individuals. For evening use, stick with the naturally caffeine-free options we've discussed. People also often ask about mixing different teas together. While this isn't necessarily harmful, I recommend testing each tea individually for at least a week before trying combinations. This allows you to clearly understand how each tea affects you personally and to identify which one provides the most benefit for your specific situation. Once you've established a baseline response to individual teas, you can experiment with combinations if you'd like. Another common question concerns the use of stevia as a sweetener. While stevia is generally considered safe and doesn't cause the blood sugar spikes associated with regular sugar, recent research suggests that some people may have insulin responses to artificial sweeteners, including stevia. For optimal results, try to train your palate to enjoy these teas unsweetened. Most people find that after a week or two, they actually prefer the natural flavors. People frequently ask whether tea bags are as effective as loose herbs. In general, loose herbs and whole spices tend to be more potent than processed tea bags. But high-quality, organic tea bags can certainly be effective and are much more convenient. If you're using tea bags, look for ones that contain whole pieces of the herb or spice rather than fine powder, and choose organic options when possible to avoid potential contamination with pesticides or other chemicals. The question of whether you can prepare tea in advance often comes up. While it's certainly possible to prepare your tea earlier in the day and reheat it before drinking, you'll get the most potent effects from freshly prepared tea. Many of the beneficial compounds in these herbs are volatile and can degrade over time when exposed to air and light. If you must prepare tea in advance, store it in a covered container in the refrigerator and reheat gently. Some people worry about the diuretic effects of drinking tea before bed. While any fluid intake will potentially increase nighttime bathroom visits, the herbs we've discussed are not particularly diuretic, and the amount of tea we're recommending -8 to 10 ounces is modest enough that most people don't experience significant sleep disruption. If you do find yourself waking up frequently to urinate, try reducing the amount of tea to 6 ounces and see if this helps. There's often concern about potential interactions with medications beyond the specific ones I've mentioned. As a general rule, if you're taking any prescription medications, it's wise to discuss herbal tea consumption with your healthcare provider, especially if you're taking multiple medications or have complex health conditions. This is particularly important for people taking medications for heart conditions, blood pressure, mental health conditions, or immune system disorders. People sometimes ask whether they can drink these teas at other times of day for additional benefits. While there's nothing necessarily harmful about consuming these teas during the day, the evening timing is specifically chosen to align with your body's natural circadian rhythms and to address the overnight processes that contribute to morning blood sugar elevation. Drinking them at other times may provide some general health benefits, but won't specifically target the dawn phenomenon that causes those frustrating morning glucose spikes. The question of how long it takes to see results varies significantly from person to person. Some people notice improvements in their morning glucose readings within just a few days, while others may need several weeks of consistent use before seeing significant changes. This variation depends on factors like the severity of your insulin resistance, the quality of your sleep, your overall diet and lifestyle, and whether you're making other changes simultaneously. As a general guideline, give your chosen tea at least 2 weeks of consistent use before deciding whether it's working for you. Keep in mind that the benefits may be subtle at first. Perhaps your glucose readings become more consistent even if they don't drop dramatically, or you might notice improved energy levels or better sleep quality before seeing changes in your blood sugar numbers. Let's talk about what to do if you don't see the results you were hoping for after giving a particular tea a fair trial. First, consider whether you might be better suited to a different tea. If you started with cinnamon tea because of insulin resistance but didn't see much improvement, you might try Fenugreek tea for more potent glucose lowering effects, or chamomile tea if you realize that poor sleep quality might be a bigger factor than you initially thought. Also consider whether other factors might be working against your tea routine. Are you eating dinner too late or consuming too many carbohydrates in the evening? Are you under unusual stress that might be elevating your cortisol levels? Are you taking any new medications that might affect blood sugar? Sometimes addressing these other factors is necessary before the benefits of evening tea become apparent. If you've tried multiple teas without significant benefit, it may be time to focus more heavily on other aspects of blood sugar management, such as adjusting your daytime diet, increasing your physical activity, working on stress management, or discussing medication adjustments with your healthcare provider. Evening tea can be a valuable tool, but it's not a magic bullet, and some people may need more comprehensive approaches to achieve their blood sugar goals. It's also worth considering that your definition of success might need adjustment. A reduction in average fasting glucose from 145 to 135 milligrams a DL might not seem dramatic, but it represents a meaningful improvement in your metabolic health. Similarly, more consistent readings, even without lower averages, can make diabetes management much easier and reduce your risk of complications. Let's discuss long-term sustainability, because the key to lasting benefits from any natural health approach is making it a permanent part of your lifestyle rather than a short-term intervention. The beauty of evening tea routines is that they're generally easy to maintain over time, but there are some strategies that can help ensure long-term success. First, don't aim for perfection. If you miss a night here and there because of travel, illness, or just forgetting, don't let that derail your entire routine. Simply resume the next night and continue forward. Consistency over time is much more important than perfect adherence every single night. Consider rotating between different teas to prevent boredom and to address changing health needs. For example, you might use cinnamon tea most nights for its glucose-lowering effects, but switch to chamomile tea during particularly stressful periods when sleep quality becomes more important. This flexibility can help maintain your interest and motivation over time. Keep track of your results in a simple log or journal, recording your morning glucose readings, sleep quality, and any other relevant factors helps you see patterns and improvements that might not be obvious day to day. This documentation can also be valuable information to share with your healthcare provider. Consider involving family members or friends in your evening routine. Having a tea buddy who shares your commitment to better health can provide accountability and make the routine more enjoyable. This doesn't mean they need to drink the same tea or have the same health goals, but having someone who understands and supports your routine can be very helpful for long-term adherence. Be prepared to adjust your approach as your health status changes. If you start taking new medications, develop new health conditions, or achieve significant improvements in your blood sugar control, you may need to modify your tea routine accordingly. This is why maintaining regular communication with your healthcare provider is so important. As we near the end of our comprehensive discussion, I want to address the bigger picture of blood sugar management for people over 50. Evening tea routines are just one piece of a larger puzzle that includes proper nutrition, regular physical activity, stress management, adequate sleep, appropriate medical care, and social support. The beauty of the approach we've discussed today is that it addresses multiple aspects of health simultaneously. A well-designed evening routine that includes the right tea, proper timing, and supportive practices like gentle exercise and stress reduction doesn't just help with blood sugar control. It can improve sleep quality, reduce stress, support digestive health, and contribute to an overall sense of well-being. This holistic approach is particularly important for people over 50, who often face multiple health challenges simultaneously. Rather than treating each issue in isolation, evening tea routines offer a way to address several concerns with one simple, enjoyable practice. I also want to emphasize the importance of patience and realistic expectations. Our bodies didn't develop blood sugar issues overnight, and they won't be resolved overnight either. The changes we're working toward: improved insulin sensitivity, better sleep quality, reduced inflammation, and more stable glucose patterns, take time to develop and become established. Think of your evening tea routine as a daily investment in your long-term health rather than a quick fix for immediate problems. Each night that you choose herbal tea over a sugary snack, each night that you take time to relax and prepare properly for sleep, each morning that you wake up with more stable blood sugar readings, you're making deposits in your health bank account that will pay dividends for years to come. Finally, I want to remind you that you have more control over your health than you might realize. Yes, aging brings challenges, and yes, managing blood sugar can be frustrating and sometimes overwhelming, but by taking simple, consistent action, like the evening tea routine we've discussed today, you're actively participating in your own health care rather than being a passive recipient of it. The teas we've discussed today, cinnamon, chamomile, ginger, and fenugreek, are all backed by scientific research and thousands of years of traditional use. They're generally safe for most people when used appropriately. They're inexpensive and widely available, and they can be easily incorporated into almost anyone's evening routine. But remember, the tea itself is just the beginning. The real power comes from the consistent routine, the mindful approach to evening self-care, the attention to sleep quality and stress management, and the commitment to taking an active role in your health management. Whether you choose cinnamon tea to address insulin resistance, chamomile tea to improve sleep quality, ginger tea to support digestive health, or fenugreek tea for more aggressive blood sugar support, you're taking a positive step toward better health. Start tonight. Choose your tea based on your primary challenges. Prepare it mindfully, drink it as part of a relaxing evening routine, and begin the journey toward more stable morning blood sugar readings. Your future self will thank you for the commitment you make today to better health through simple, natural, time-tested approaches that work with your body's natural wisdom rather than against it. Here's to better mornings, more stable blood sugar, improved sleep, and the confidence that comes from taking control of your health one cup of tea at a time. Sweet dreams, stable glucose, and here's to waking up tomorrow feeling more energetic, more optimistic, and more in control of your health than you have in months or even years. The journey to better blood sugar control starts tonight, with something as simple as the right cup of tea at the right time, prepared with intention and consumed as part of a commitment to your own well-being. Remember, you're not just drinking tea, you're practicing self-care, investing in your health, and taking concrete action toward the vibrant, energetic future you deserve. Every sip is a choice, every night is an opportunity, and every morning a chance to celebrate the progress you're making toward optimal health and vitality in your golden years. The power is in your hands, or more accurately, in your teacup. Use it wisely, use it consistently, and prepare to be amazed by what your body can accomplish when you give it the natural support it needs to function at its best.